the idea of being able to capture those people before they become sick is, that's kind of like the holy grail of medicine, right? How do we keep people healthy? How do we keep people from becoming ill? And that's going to translate in the long run to reduced healthcare expenditures and things like that as well.
Welcome to Startup Health Now, the podcast where we celebrate the entrepreneurs and innovators reimagining the future of health. I'm your host, Logan Plaster. Typically on this show, we talk to health tech founders who are creating the tools and platforms that will modernize our healthcare system. Today, we have a different kind of guest who will help round out this picture of just how a healthcare innovation goes from idea to real-world implementation. My guest is Dr. Robert Wilson, a family physician who runs CovenantCare, a multi-site medical practice in Tennessee. Dr. Wilson popped up on our radar because he was an early partner for PreventScripts, a startup that's part of the Startup Health portfolio. PreventScripts, led by Brandi, Harless, and Dr. Natalie Davis, has created a platform that helps family docs like Dr. Wilson identify patients who would benefit from chronic care management. Think about a patient who is pre-diabetic and all signs point towards a long battle with type 2 diabetes. While Dr. Wilson might be too overextended to identify and coach this patient before the disease sets in, PreventScripts can identify the risk and put the patient on a clinically proven program. Patients with chronic diseases or the risk of disease get heightened care between visits, and Dr. Wilson gets added reimbursement. I wanted to get Dr. Wilson on the phone to understand why he was interested in partnering with a healthcare startup, because this is one of the key hurdles for any health innovator. How do you find the right clinical partner, a place to prove out your brilliant idea in the real world, and then iterate based on patient feedback? In the conversation, we'll get into those real-world challenges that Dr. Wilson faces, as well as his motivation for evolving his practice. Enjoy. Dr. Wilson, thank you so much for taking time with me at Startup Health. And I want to just start by understanding your medical practice, CovenantCare. Tell me about the providers that are on your team and your typical patient population.
Sure. Yeah. CovenantCare is a multi-location single specialty group composed of family medicine providers. We have 4 physicians and 8 advanced practice providers spread across 4 locations in 3 counties. So 2 of which are pretty rural, and 2 of our offices are also located in Clarksville, Tennessee, which is, fairly large in Tennessee standards.
Got it. Are all your clinics in Tennessee?
Correct. Yeah. Right now, they're all still in Tennessee.
Yeah. There's a lot of talk, a lot of chatter about the state of primary care, especially in our world of health innovation and the challenges and the barriers to care that exists for preventative health. And I just wanted to hear from you what you feel like the current state of primary care is in the United States, looking at your slice of it.
Yeah, I think the best way to probably say is probably transition. Transition is things that there's transition in, are patients seen primarily by a physician, or are they seen by advanced practice providers? There's transition from your traditional fee-for-service model to quality-based model, value-based care models. So there's quite a few transitions that are happening within the primary care sphere at this point. And it's kind of a little bit of a challenge to kind of navigate it all and try to figure out which bucket you should be kind of focusing on in terms of our limited set of resources. So transition would be the best analogy I can give for primary care.
What is pushing those transitions? What are the drivers and the incentives behind the various ones you just mentioned?
Well, obviously payers, they kind of drive
what they'll pay for.
Mm-hmm. Yeah, what they'll pay for. Medicare is a big driver. They have implemented several primary care focused initiatives over the last several years. CovenantCare was part of one of those early adopters to what's called the Comprehensive Primary Care Initiative. That was ended in 2021, and we have since kind of the follow-up program is called the Primary Care First Initiative, and we're also enrolled in that currently. So I'd say Medicare is a big driver towards the preventative services and the value-based care. And then we're starting to see that trickle down, at least in our area. I know some parts of the country have a much higher managed care population, but we're starting to see that through the Medicare Advantage programs, as well as some of the Medicaid programs that have quality-based programs tied to those to their reimbursement model as well.
Got it. How long have you been in practice?
I graduated medical school in 2000 and did my residency in 2003 and moved to Tennessee and have been here since. So I guess that's 19 years out of residency. Yeah.
Have you seen any dramatic shifts in your patient population, the kind of challenges that they face?
Primary care is an interesting thing because we see all ages. As family medicine, I just had a 2-week-old newborn checkup the other day, all the way up to one of my older patients is like 102 years old. And so we see, quite a large range of patients. I think the biggest issue is the transition to the value-based model and the instead of the traditional fee-for-service model. Probably your biggest change we're seeing within the population itself.
Got it. So we're having this conversation today because CovenantCare has partnered with PreventScripts, which is the company that Startup Health has partnered with for many years in order to improve the outcomes of folks with chronic illnesses. So I'm hoping you could describe the relationship that you have with PreventScripts.
Sure. I was approached probably a little over a year ago. A friend of a friend. That's how most of these things are. Kind of the connections are happen. And I've always had a desire to be more preventative when it comes to, or proactive is the word I sometimes will use when it comes to my patient health statuses. The problem is medicine has historically been reactive, and we kind of wait till people get sick, and then we kind of treat the illness and try to keep them from having, secondary complications from their illness. So PreventScripts is kind of an interesting idea in the sense that they are trying to target people who are at risk for disease, but yet not have the disease and are also highly motivated. And so there's a lot of people you can find that are obviously at risk for disease, and they're just not motivated to make the necessary change necessary. But PreventScripts has modeled this questionnaire and preventative questionnaires that we can administer via our check-in module, which we use Phreesia for our check-in system in our EMR. And they will give us a categorization of their risk for diabetes, their risk for heart disease, and also what's most fascinating to me is their desire for change. So are these patients motivated? And so what we're trying to do is capture those patients who are highly motivated, yet not have disease, but are at risk for disease. So those are going to be like family history, obesity, mildly elevated blood pressures. There's some other things that put them at elevated risk, but the idea of being able to capture those people before they become sick is, that's kind of like the holy grail of medicine, right? How do we keep people healthy? How do we keep people from becoming ill? And that's going to translate in the long run to reduced healthcare expenditure and things like that as well.
And explain to me how that compares, what you just described with PreventScripts and their questionnaire model, how that compares to the current standard of care. I'm sure the physician doesn't have a lot of time with each patient to try to suss out their future risk of a disease, their interest in tackling that condition. So how do the two compare?
Well, they're kind of night and day, because you're right. I mean, we're always strung within the time limits of the visit to identify, medication refills, any current, complaints from the patient. This is a way to kind of gather this data, and it's patient-driven data. So it's not something that I actively have to go get. So it empowers the patient to enter the information and allows me to then use that patient-generated data in a more meaningful manner. Anything that disrupts the normal workflow is going to be a bit of a challenge. So having something that can be administered in concert with the normal workflow of a traditional, office visit is going to be something that's going to be much more likely to be adopted.
Yeah. And I'm guessing that for it to be adopted, it's got to hit both the patient side and the reimbursement side. So, I mean, I've read plenty about, primary care medicine struggling with reimbursement and really needing to build stronger economic structures for these practices in order to provide great preventative care. So how does PreventScripts not only help you treat people more preventatively and better, but also help your practice stay profitable?
Yeah, I think it's a two-pronged approach. One, the preventative questionnaires have a small reimbursement associated with them. But there's also the secondary piece of, okay, so now you've identified these people, and then how do we then move in a direction to help them make that meaningful change thereafter? And there has been some change recently, and a lot of the insurance companies will allow us to do some of these preventative visits. They're a little bit lower reimbursement than a traditional, E&M code, but you can do multiple visits over the course of 4 to 6 months, and you're really trying to help the patient and guide the patient into improving their overall risk stratification and lower their overall risk of heart disease and diabetes.
Got it. Now, not every doctor or clinic is willing to take a chance on a new technology. I'm sure that this comes with time that it takes to get onboarded and to understand something new. And even if something is broken, if you know it, sometimes you'll stick with that for the long term. So, what was it about this or you and your clinics that made you willing to kind of take a chance on a new technology?
Well, from our standpoint and our situation in particular, it wasn't going to be a huge change to our traditional workflow because we already use a patient-driven check-in system that utilizes preventative questionnaires such as the PHQ-9 and some of the other screens for well-child visits and such. So adding this in was not going to be a major change. The big change is on the back end on how we deal with this data because, most primary cares are like large ships. It's very hard to make a significant change, and it's difficult to fully incorporate the mindset to become more proactive instead of be reactive. It's easy. We've been treating diabetes and hypertension for, hundreds of years, and we're all very, good at it and skilled at it. What we're not very good at is this very thing. How do we keep our patients from becoming ill? And I think that's the thing that drove me to kind of looking at this in more detail. Seems to be in line with the way that I would like to practice, which is being more proactive instead of reactive. It's giving us the opportunity to become more proactive.
Yeah. Now, I'm guessing since PreventScripts is a startup, I'm guessing this has been an iterative journey where there's feedback, feedback being given. And
yes.
How has that been? Like the idea that you're not dealing with a sort of perfectly finished product. You're actually part of the process of perfecting it.
Well, I think it's a bit of a challenge, but it's also a wonderful opportunity because you get the opportunity to engage with the people who are creating a product to make sure that this product is actually applicable to the day-to-day practice of medicine. Because one of the biggest things, there's a lot of wonderful ideas and there's a lot of great technology out there. The hardest part is how do you integrate that into a traditional workflow and get that information into and in front of a provider at the time they need it to impact a decision. And we see that with a lot of the wearables and some of these other things is that they get great data, but I don't get to see it.
Yeah.
The patient sees it. And, unless they bring their iPhone in or their Android and physically show me, here's my steps per day and this kind of stuff, we don't have the ability to integrate that. This gave us an opportunity to integrate that directly into our EMR, goes right into the patient's chart. There's a small reimbursement, which is always helpful. So you're not doing something for free. But I think that the ability to get the data real time and use it at the time you're seeing the patient is the most helpful data you'll ever get.
Yeah. That's awesome. I think it says a lot about you and about your business that you are interested in being a part of that innovative process, and wanting to shape it for other people. Say, hey, let's make sure that primary care providers and people with boots on the ground are a part of the innovation process. Kind of a bigger theme that I wanted to get at with this interview is that we work with more than 400 startups in healthcare, and many of them struggle with exactly what you just described, integrating their early stage idea with a provider network. Oftentimes they go after big hospital systems and it's too much.
Yeah.
I often direct them towards more independent clinics where they might find somebody with your mindset, so that they can work shoulder to shoulder with providers, taking care of patients every single day.
Mm-hmm.
So I wonder if you have any advice for a founder or a provider in that setting to make that process move more smoothly.
I think the most important piece from the provider side of it is that it always goes down to the workflow. How is this going to interact and integrate into a provider's daily workflow? And if the farther outside of that traditional workflow pattern, the more difficult it is going to be to integrate. And you mentioned some of the challenges of implementing kind of being essentially a beta tester for all intents and purposes. Is how do you get that data in real time? How do you get it into the chart? How do you impact workflow, with the least amount of disruption as possible? And I think the ideas are excellent. It's just how do we implement them, and trying to find somebody who's willing or able. Sometimes that's even more important, to integrate or try something new. I mean, it's going to be a bit of a challenge. Yeah. I mean, it would be nice if there was, some sort of kind of system where you could hook up people who might be interested in that, because a lot of primary care providers are not happy with the status quo. Yeah. We don't like the fact that we have to wait till somebody's sick in order to really impart our clinical judgment. So we would love to find ways to integrate prevention and risk reduction and all of these things into our daily practice, because that ultimately, especially in family medicine, we take care of the whole family. We take care of mom, dad, grandma, children. And we want, when we impact our advice, it trickles down throughout the entire family. And so if we have a system of apps or, integrations that will allow us to give that information in a more timely manner, that's going to be something that will be much more meaningful. There's a lot of data you can get. And that's one of the biggest challenges is we often get inundated with data, and how do you interpret that data and use it in our day-to-day workflow is key. That's got to be part of the equation in order for something to become successful.
Yeah, that sounds like that's the secret sauce, how you actually integrate it. It almost sounds like someone needs to come and sit with you and observe your clinic for a period of time to understand, okay, what are the real bottlenecks? Not the ones I thought were challenges when I was building my business, but what's really happening with you. And I'm guessing those are some of the things that PreventScripts, that Brandi and her team are learning. Yeah. How do the real challenges differ from maybe what I imagined that they were?
Oh, absolutely. Because, anytime you start doing it in the real world, you're always going to little things like how quickly it gets integrated in the chart. Is it actually real time when you thought it was going to be real time, but it actually isn't? It's delayed by 30, 40 minutes and the patient's actually already left the building. So, there's all these little challenges that we've overcome, and they've worked diligently with our EMR provider to integrate their systems directly into the patient's chart. So they've had a really nice cooperative kind of mindset to help us limit the disruption to our workflow.
Got it.
So that's been a very pleasant experience.
In general, do you feel like there's anything particular that people get wrong about the primary care workflow? If you think about people trying to create innovations and solutions for you, is there like a primary misconception about the work that you do?
Oh, that's a good question. I think the answer is yes, there are. I think it involves the aggregation of the data and how that data gets to us. I think what we need is that data compiled in some sort of easy and quickly read, I guess, I don't know, infographic, some sort of way for us to interpret all this data, because a lot of these things collect a lot of really good data. Problem is, it takes you 20 to 30 minutes to parse through all the data and find out, okay, what is the trend line? What is are all the outliers, and those kind of things. And I think in order for it to work in a primary care environment, it's just got to be something that can be displayed quickly, display the information quickly, and kind of impart that information to the provider in a way that they can then act on it without having to do a bunch of legwork and research.
I love it. I'm going to make sure to share that with our community of entrepreneurs and see if anyone comes back with you with a pitch. So Dr. Wilson, sure. That's the time we have. I don't want to keep you from your patients any longer. Thank you for sharing with me about your partnership with PreventScripts. And I appreciate you, going on that iterative journey with them and being part of creating a solution that will be helpful, not just to you and your patients at CovenantCare, but really to so many more as it gets built out and scaled.
Well, thank you for having me. And I appreciate the opportunity to kind of give a perspective on the primary care side of things, and look forward to where medicine is moving in the future.
Awesome. Thanks, Dr. Wilson.
No problem. Thank you. Have a wonderful day.
Bye-bye.
Thanks for listening to Startup Health Now. Startup Health invests in health transformers around the world who are dedicated to achieving audacious health moonshots. If you want to learn how you can join this community of entrepreneurs, or if you want to connect with one of our 400 companies, go to startuphealth.com. If you'd like to learn how you can invest in our Health Moonshot Impact Fund, go to healthmoonshots.com. Thanks for listening to Startup Health Now. We'll be back again with another episode next week.